Hey guys, it is your girl Coach Eli coming to you live from Maryland, and I am excited to be here today. Today we are going to talk about medical review officer, aka MRO. A lot of you have contemplated issues or questions regarding who an MRO is, how you can find your medical review officer. Um, Everything surrounding medical review officer and billing is gonna be my topic for today. I want you to go ahead and subscribe because I will drop this more of this content, the things around medical and diagnostic labs, so you want to be in the know when I drop my videos. Like I said, today we are going to be focusing on MRO. I've seen a lot of you confused and don't necessarily understand the difference between a medical review officer and, of course, a lab director. And I will tie the lab director part into billing. I'm going to talk a little bit about diagnostic lab on its own. But before I proceed, allow me to quickly break down these two concepts for you. Diagnostic lab is where you are conducting point of care testing like clear when you have your clear and you're able to do COVID testing, rapid HIV testing, flu, RSV, all of those point of care testing such as urgent care, where you get to be the lab, you get to have your own supplies, you get to do the testing and you give the results. Should your patient have an elevated result or positive test results, you are responsible for taking care of that, meaning that you have to provide what's care, you have to treat because you're diagnosing, right? So diagnosing and treatment, right? You are responsible for every diagnostic testing, point of care testing, and the other ones are drug testing and DNA. So with the drug testing, you need an MRO, right? Because you want to do a DOT testing. For DOT, trust me, you don't need an MRO. But if you're doing a lab-based drug testing, you need an MRO. We talk about all of this in mentorship. I do have a private coaching sessions, even group sessions. So we break all of this concept down when we are in training mode. But today, allow me to break these things down and of course explaining that who an MRO is and how you can go about finding your own medical review officer. So as you already know, it's MRO stands for medical review officer, and only a medical doctor, not a nurse practitioner. Okay, be very mindful and careful of that. A nurse practitioner can't be a MRO, and that's because of their license, sure, right? The level of education. Remember, DOT is a regulated testing by the federal Department of Transportation, so they regulate that only a medical doctor can be an MRO. So when you are looking for an MRO, you do have to go through the lab. In exception of LabCorp sometimes require that you provide them an MRO. I'm gonna come back to that in a minute, but allow me to explain to you on an MRO what they do. So when you are setting up your lab account with a toxicology lab, a Sancha approved lab, when you're trying to set up your toxicology lab account, aka your drug testing lab account, remember we have the toxicology, which is for drug testing, and we have the clinical lab account, which is for blood draw, every other clinical needs, where you also need a practitioner or a provider. All right, those are different facets, but remember we're talking about medical review officer, so let us stay on topic today. So you would need a medical review officer because DOT regulates that, and it's required, because once your result comes back from the lab will send your result to the MRO, and the MRO will release the result based on the findings or the lab results, right? That's how that works. That's the process. So for you, how that applies to you as a lab owner or as a drug testing company, you would need your MRO. And sometimes my students, or most times, will learn that when you are doing a drug testing, you do have to fax the second page, which is the MRO copy, to the MRO. The first copy goes to the lab with the specimen that you send in, right? When you collect your drug testing specimen, that's the urine. You send the first copy of your chain of custody to the lab, and the second copy you have to fax over to the MRO. If your MRO does not have your chain of custody on file, they will not release your results because that's the process, right? You send in the specimen and the lab releases the result to the MRO. You are responsible for faxing the second page to the MRO. Once they have that on record on file, they can review and release your result back to you. So when you're looking for an MRO, you want to make sure that they are affordable. That's one thing that you should be doing, because again, shopping for MRO could be tedious, or not necessarily shopping. When the lab presents you a long list of MROs, you do have to find the ones that are affordable. So you also want to make sure that the MRO has a combination package, meaning that they are not only going to review your DOT lab, they also can review your non-DOT specimen, and that they are able to receive fax or email. Sometimes fax don't go through, sometimes it's expensive to pay for fax, right? So you want to make sure you have an MRO that can transmit through emailing, because email is more affordable and cheap. How about that? So, and it's more secured, and can also allow you to keep track of all of your activities, all of your documents, right? Those are some type of electronic records right there. So emailing is good. So when you're looking and shopping for an MRO, make sure they have all of these things. And lastly, they are reachable, and you also want to ask for their turnaround time. Very important in what you do, what you sell, because your customer service needs to be top notch. You want to make sure that you're promising quick turnaround time. Those are the part of things we talk about in marketing as well in training. So make sure you have all of those. So MRO differs from a medical director. MRO is only for toxicology, for drug testing. A medical, the other guy, which is the lab director, is for your clinical. That's the diagnostic lab industry, where if you're not a provider, you will need to have a provider, especially if you're doing point of care testing, aka diagnostic testing. For example, somebody comes to you and they want to do an HIV testing, or want to do an STD testing for gonorrhea, syphilis, all of this STD testing, right? And you happen to test them and their result comes back positive. According to the health department, you can't leave someone hanging. You have them, they have the diseases. Two things that is important for you to do is, first, you have to report it as this. So those are the things that your protocol has. Remember, you have policies and procedure in place, so you have to follow your policies and your process for reporting. Then once you report that back to the health department, you also want to make sure that you are treating them. That's where your provider comes in place. And so in this case, you can use or enroll or hire a nurse practitioner. Will do for this one. Not a registered nurse, not an LPN, not a CNA. The next level in nursing is the nurse practitioner. They can write prescription and treat this patient. That's what we call diagnostic. You're treating and you're helping. So you are responsible. You also will need to have an EHR system where you have to put everything. Just imagine you being a patient. When you go to your doctor has all of your health records, your EHR, they have an EHR where you can access. So these are the things that you also have to put in place. We talk about all of this in training as well, but that's the diagnostic lab, medical review, health doctor, the clinician, the clinical director, and the difference between an MRO. So let me quickly wrap this up by letting you know that your services are also billable. Some of you don't know that everything you do here is now cash based. This is another way to expand your cash flow, or to expand your revenue or your profit. So you would have to be Medicaid to be able to accept insurance. It could be Medicaid, it could be Medicare, it could be private insurances again. But you do have to go through credentialing, and maybe I'll come back and do another filming on billing services, because again, I think it's a pertinent topic that a lot of people are not inclined or acquainted to in the industry. I would definitely come back and talk about billing and insurances and all those type. But your diagnostic testing are billable, meaning that you can bill insurances and insurance will disburse. They will pay you for your services, and you'll get payments. People who wants to pay for healthcare out of pocket. So these are the things that you can look into in 2025, expanding your services and being able to serve a larger audience or broaden your clientele. So I hope this is helpful, but that's the difference between an MRO solely for toxicology, and of course your clinician, physicians, they can help you with billing, you can take insurances, and you can do point of care testing. That's more clinical. So hopefully this is helpful. It's your girl, and make sure you subscribe, because again, we're going to be back with more details and more topics on other things in the industry. That's it for now. Bye.